Deep brain stimulation as addiction treatment. In deep brain stimulation, or DBS, electrodes are surgically implanted in specific locations of the brain. A wire running under the skin attaches these electrodes to a pulse generator surgically implanted under the collarbone. This pulse generator is programmed to transmit continuous electrical impulses to the specific areas of the brain. In clinical trials of DBS as addiction treatment, the electrodes are placed in areas like the brain's reward system and frontal lobe. When the brain perceives a possibly rewarding stimulus, areas like the amygdala and the hippocampus work to process the experience. Once the stimulus is recognized as rewarding, the ventral tegmental area is stimulated to produce and release dopamine. When it comes to natural rewards like social interaction and food, the ventral tegmental area receives signals from other parts of the brain to produce dopamine. However, with drugs that are commonly abused, they can directly stimulate the ventral tegmental area's release of dopamine. Dopamine released in the ventral tegmental area travels through the mesolimbic pathway to the nucleus accumbens, where it binds to receptors on the surface of neurons. The changes in neuronal activity are interpreted as feelings of reward and pleasure. The prefrontal cortex then associates these feelings of reward and pleasure with the original stimulus and the action taken. This reinforces behaviors, especially behaviors of drug abuse, as they generate intense feelings of pleasure. Eventually, repeated abuse can lead to reliance on substances to maintain these feelings of pleasure, and over time, the constant release of dopamine can impact how other neurotransmitters work. Impulses that are delivered to the reward centers in the brain by DBS work to gradually release dopamine to reduce drug cravings, while impulses delivered to the frontal lobe of the brain aid in proper decision making. Although this procedure is still in its clinical trials, some patients have been able to achieve sobriety. However, it's important to remember the multiple factors that affect sobriety, such as strong support systems and even access to treatments like these. Overall, this research is crucial to understanding addiction as a neurological problem, and this research destigmatizes addiction by approaching it as a chemical imbalance rather than a problem of will.